Miss G, we are live in YouTube na po.
Okay, yes, thanks. We're just waiting for Dr. Lucien to join us, right?
Yes po.
Yes.
Maybe we can flash already the cover slide. Use the slideshow format, Sam, so that at least when the members of the Philippine Marketing Association start to come in, they can see it when
Sige.
they join our meeting room. And then could somebody let me know when Lucien is already in the room? Although I do see a couple of PMA members as well. So good afternoon, everyone. We're just going to wait for your president, PMA President Lucien Di Choco, to join us before we start. Yeah, unfortunately, Jopin Romero, who's our Project ARK leader, won't be able to join us this afternoon. They needed to attend urgently to a very, also a very important appointment with some partners. And Claire, is PA Joey going to be joining us anytime this afternoon?
We're still checking at Eva.
All right.
I'll let you know po.
Okay, all right.
Miss
But yeah.
Sir Lucian is here na po.
Okay. Hi, Lucien.
Hi,
Hi, good afternoon.
good afternoon.
Yes. Okay, so it's 3:06 p.m. I was advised that Alpha won't be able to make it. But you do have a couple of members here already in the meeting room, and then I think you have many members who might be watching through Facebook or on the web.
Yes,
Yeah, so
yes.
just let me know when you'd like to start. I was saying earlier that Jopin can't make it this afternoon, no, but myself and George Royeca on behalf of Project ARK are here to do the briefing. Dr. Mingita Padilla also won't be able to join us, so we'll do our best to explain the medical protocols segment of the presentation.
Okay.
Yeah. So just let me know when you'd like to start. We're now live also streaming. So I'll just wait for your go signal.
Okay. What am I supposed to say?
Okay. Well, usually when we start off, I'll introduce you, and then you can give like a welcome message because these are your members after all who are attending the briefing today. And then we'll also do a short photo opportunity. So our team will just cue the members who are present to turn on their videos. I know that many of us, like myself included, to save the bandwidth, no, nakapatay yung mga video natin. But we'll take a quick photo. The team will cue everyone just so that we can see all your members who are present. Just to mark also this occasion that we're doing this partnership and collaboration with PMA, and then we will segue na to the formal presentation. And then after that, after that presentation, we will open the floor for Q&A. Claire also sent
Okay.
us a couple of questions in advance from some of your PMA members. So we can also start with that to to begin the Q&A session later. Is that okay? The flow is
Yeah,
okay?
that's okay.
All right. Okay. Sige. So let me know lang when, Lucian, when you would like to start, or if are we waiting for any more of your maybe officers from PMA who'll be joining?
No one, no one.
Okay. So
I
good.
think it's just me.
Okay. Sige. So we can start na?
Yeah.
All right.
Hi. Hello.
Oh, hi, Christine.
There's
Hi.
Christine.
Yes, I'm here. Anyway, I heard what you're talking about. So we'll
Good
just, yeah, good afternoon. We'll just, how many members do you want to be online before you want to start?
It's really up to you, ma'am. I mean, kayo po magsasabi sa amin. We allotted kasi 3 o'clock to 4:30.
Okay.
Yeah, in our experience, that's usually enough, and especially to cover maybe the questions. The advanced questions from PMA medyo madami, no? So I'll answer some. George will take the other questions. We just want to have enough time lang to answer these questions, no, for your members. So we can start anytime. I'm waiting lang for your go signal. We're
Hi.
live already, so yeah.
Okay. Anyway, Claire told me that there are already 11
Mm-hmm.
yeah, who are online. So, President, okay lang ba sa'yo if siguro mga 3:15, like in 6 minutes?
3:15.
Okay.
Sige. Well, I'm still trying to figure out how I can connect from my laptop.
Oh yeah, you're on the
Right
phone,
now,
no?
I'm just on my phone.
Kaya vertical yung screen mo. I think also Dr. Elton is on his phone. Dr. Elton, are you on the phone? You're not on your laptop? Kasi vertical yung orientation. What you can do, Lucian, is but you have Zoom no on your
I do, but I'm just checking if my Zoom is not updated pala.
okay. Mabilis lang naman to but yun nga baka mawala ka.
Yun nga eh.
Si Dr. Elton din yata naka-phone siya. Because we can see na vertical din yung orientation. Ganyan.
So I can just say in 3:15 we will start, no?
Sige, yes.
Sige, I'll just put a
Yun.
note in our member Viber chat.
Okay. All right, ma'am. Sige po. Lucian, you're on mute. I think you're on mute. You can unmute yourself. Yeah, it's 3:15. So
Wait
please
lang.
moderate.
Just a few more minutes.
Okay, all right. Sige. Just let me know. Thank you.
Okay.
I'm just here, ha. Uh, how do I call your Gingay?
Ingay, yes. Hi, Christine. Yes.
Guy. Yes.
Okay, all right. So we'll just wait lang for Lucian to signal that he's okay to start.
Okay.
All right.
Would you know, makikita mo ba kung how many na yung naka-on?
Meaning online here in the meeting
Yes.
room? Yes.
How many are there na?
One, two, three. I believe these are 13 people.
13.
Yeah.
Sabi nila, ang nag-register kasi mga 45 eh.
Oh, but maybe some of them are watching it live, yung live streaming
I
on
see.
YouTube kasi we're on YouTube and Facebook. So
Okay.
maybe they registered, meaning they're gonna attend, but they're probably doing it. They're
Somewhere.
watching yeah, they're not like they're not what you call this joining.
Mm-hmm.
So that's also possible because Claire,
Yes.
yeah,
ma'am.
because Claire we had mentioned that to us earlier na merong ibang members from PMA who will be watching live and then the others will be here in the Zoom meeting. Tama ba?
Okay.
Yes po. I actually shared the link to
Yeah.
Richard.
Okay.
Okay. Okay. I can't connect from my laptop. My laptop froze.
No problem.
I'll just do it from my phone.
Okay, sure, no problem. Sige. So we can start, Lucian?
Yes.
Okay. So good afternoon, everyone, and welcome to the Project ARK discussions with the Philippine Marketing Association. We'd like to thank, of course, your president, Lucian Ditioco, and of course, Ms. Alpha, although unfortunately she wasn't able to join us this afternoon. But we'd like to thank you very much for the time that you're going to share with us this afternoon until around 4:30 so that we can discuss fully with you about Project ARK, what we are doing together with many other member companies as well as LGU partners. And also to answer all your questions. I believe some of your members had sent us advanced questions, so we are more than happy to answer that. Together with me from Project ARC, we have our core team, Mr. George Royeca, who is the Chief Transport Advocate of ANCAS, founder of ANCAS. He's also with us. He's our consultant for Project ARC and responsible for helping us put together the framework and also in charge of helping us with the data consolidation for all Project ARC testing results. So George is with us this afternoon. And then, of course, we also have Claire and Sam who are with us today. So, Lucian, before we start, may we ask you for a few words?
Hi. Good afternoon, everyone. To all the PMA members, good afternoon for this afternoon session. In conjunction with the organizers of Project ARC, you know, it's kind. This is very welcoming to all members because it makes us see the possibility of doing testing, especially where there's really a sentiment of everyone being mass tested. But it's not really that an issue, um, because it's not as easy as you think it is. Mass testing, for one, is not really an easy task to do. For one, there's the availability of suppliers to conduct mass testing, and second, it's very expensive. The device is very expensive in the process. So Project ARC is a very welcome endeavor that we should pay attention to. So I hope you'll be listening through the session for this afternoon. Good afternoon, everyone.
Thanks, Lucian. I'd also just like to call on George to say hello to everyone from PMA.
Hi guys. Thanks very much for this meeting, no? And hopefully we get to present to you guys, the possibilities of how we can conduct testing in your workforce. So maraming salamat po.
Thanks, George. You're very bright and cheery ang kulay mo today. You're in red.
Oo nga eh.
Parang Valentine's. Okay, sige.
Valentine's.
All right. Sam, can we, do you want to do Claire muna yung ano pala natin, yung photo? With people who are already here in the meeting room? Baka magkalimutan tayo dito. So maybe we can ask everybody lang to put on your videos, your cameras, just really briefly. You can still be on mute, pero naka-camera, and then we'll just all smile. Yan. Okay. So Claire, can you be the one to pause? Claire, are you here? You are
Yes, ma'am.
sige. Claire, we can't hear you.
I'll
Sige.
the picture na rin.
Nag-freeze na yung mga smile namin. Si Lucy gumagalaw. Oh.
1, 2. Okay.
Okay, are we done? Are we good?
Yes po.
Okay.
Yes po.
Right. Thank you. Okay, thanks everyone. Okay, so we'd like to flash now our presentation deck. All right, thank you. Sige, let's do a slideshow so that the members can see it clearly. Okay. All right, so welcome once again to our discussion on Project ARK together with the members of the Philippine Marketing Association. As most of you likely know, Project ARK is a private sector-led initiative under the Office of Presidential Advisor Joey Concepcion, who is also the chairman of the RFM Group and founder of Go Negosyo. Claire, can we move to the second slide? Because I think that's more... Yes, okay, thank you. All right, so just going back to that. So it's a private sector-led initiative where the advocacy of Joey from the very beginning of when this pandemic started is really to make testing, whether it's RT-PCR or antibody testing or any new testing technology that may even come up in the future, to make testing affordable and accessible to everyone. So that has been the advocacy from the very beginning, and the objective of having access to all these different testing tools and making it affordable and accessible, and capturing and consolidating the validated test results, this data universe, is really to help our decision makers as we have been slowly moving from a lockdown scenario, ECQ, for the past 3 months, and then now to a GCQ, and in some areas modified GCQ. So we'd like really to build the data on what is the real situation on the ground in terms of the real levels of COVID exposure in our communities. So we have a total of about more than 218 member companies as of today. And these companies are, the employers are committed to regularly testing their employees, especially as a lot of businesses now are opening, the economy is restarting. We have facilities and establishments that are also gearing up to open once again to the public, to their consumers, to their customers. So we really need to make sure that we can continue to ensure the health and safety of our workplaces, of our workforce, and also the general public. Which is why in Project ARK, we have, aside from the testing that companies are doing in the private sector, we are also very much active in partnering with LGUs for the testing of general population in barangays. So as I mentioned earlier, there are two main testing pillars in Project ARK, and both of these are in support of the government's initiatives, no, and their mantra of to test, to trace, to isolate, and of course to treat. No, so we are a partner of government, very active partner of government. We've been supporting these testing initiatives, and in fact, later George will talk about the involvement of Project ARK in the task force T3 of Secretary Dizon. Okay, so I mentioned earlier that we have two testing pillars, no? So the first one is the RT-PCR initiatives, where we are partnered with government to support DOH accredited hospitals and laboratories and increase their capacity for testing. And we will show you later the accomplishments that we've been able to do together with several private sector donors, not to increase RT-PCR testing capacity, which is very important as the country continues to battle COVID and to manage, how we live and how we cope in this pandemic situation. And then the second pillar is the rapid antibody testing, which is being used as a screening tool for workforce reentry, and also for for testing general population in our barangays and our communities in partnership with the different LGUs. So these are the two main pillars for testing right now. And moving forward, we also believe that Project ARC will be very much instrumental in always putting forward very relevant and useful, testing technologies as they come online, as they become available. We will be, we are building the database of testing results that will be shared with everyone, and George will also talk about this later, because this is also a universe of testing data that we are sharing with the government, with the Department of Health, and with the IATF. So this is the information is really a key component of the efforts that we are doing in Project ARC. So we are happy to welcome PMA into this advocacy, into this movement, and we look forward to a very dynamic collaboration with PMA, and of course your member company, some of whom may actually also be already members of Project ARC. Okay, next slide. Next slide, Claire. Can we move to the next slide? Okay. At this point, I'll ask George to explain this. As everybody knows, George is the founder of Angkas, so he can give a very clear perspective as well from business. So, George.
Hi, thank you, Ma'am Gingay. Hi everybody. Good afternoon po. So basically, simple lang po yung, I guess, objective of ARC, no? The two-step process that we really push in terms of, our efforts for mass testing or mass screening is really a combination of rapid test kits or antibody testing, whether they be lab-based or rapid, which is the cartridge that gives you the test results in 15 minutes, and RT-PCR po, which is the confirmatory test. So really, ang layunin po natin dito sa Project ARC is i-test po lahat, as many people, as many types of communities, as many organizations as possible. And I think later on, as Ma'am Gingay will present to you, what is this tandem between the private sector and the public sector, we'll be able to gain visibility in terms of who may have COVID, and how do we protect the general population from further spread of the disease. So the first step po is really to apply, the most cost effective. When before Sir Joey po started this vision po for Project ARC, test kits were about 1,000 pesos per test. And because of the efforts of everybody here in Project ARC, pushing it with suppliers, negotiating po directly from the factories, we were able to bring it down to as low as 450 pesos. And this was the first step. The first step was really to bring down the pricing for rapid test kits and be able to use this as a way to screen many communities in a scalable way, cost effective and scalable. So dito po, si screen po natin dito using rapid test kits. And now the second phase po is lahat po ng maging positibo dito sa rapid test natin na i-explain naman po dun sa medical protocol kung ano po yung magiging management po and interpretation of these results for those that need to be able to be checked for RT-PCR. The idea is to identify them as quickly as possible, isolate them po, and test them, swab them for RT-PCR so that we can confirm if they're truly COVID positive. But the idea is, even before that, ma-isolate na po natin sila or ma-quarantine na po. Para po, hindi na po sila nagsispread po ng infection sa ating komunidad. As a second step of Project ARK, no, RT-PCR is really an important and critical part of the process. So right now, as what Ma'am Gingay mentioned earlier, si Project ARC po has put together donations for automation machines, automation machines para po ma-increase yung capacity ng many of our hospitals. Right now, with the help of Project ARC, we may be able to increase thousands of capacity per day, just on the RT-PCR side. So pag nakita na po yung RT-PCR testing natin, yung resulta po niyan, then we are able to now treat, and be able to really see the extent of the infection for both active and recovered in the community. So, one of the three pillars talaga of government, and I think not just the Philippine government, but any government in the entire world, is to test, to contact trace, and to treat. And testing is really one of the, it's the biggest way for us to be able to see this enemy. And this is what we espouse in Project ARC, and hopefully if you find value in this, and we'll be able to work together to really see what we are dealing with and be able to stop the further spread of the virus. Next slide. So ano po yung ating goal, right, sa Project ARC? We are doing all of these testing so that we can be able to ultimately bring back the economy. Even if it's the new normal, at least we can move forward with our lives and really, go get back on the path to normalcy. Now, the problem po with this disease is, the only way to stop po COVID is to really be able to create that vaccine and administer it. That's the only way to stop COVID. Now, based on different estimates, you have estimates of months and even years. No? So what do we do before then? Do we just stop the economy? Do we just stay in our homes? How do we now, work and live? So the idea po really is, we need to create a framework and we need to create a system that can allow us to coexist with the disease. Yung po talaga yung gusto natin gawin. And with Project ARC, that is the aim. Our aim is to be able to manage the spread of the virus by testing so that we can have more visibility and we're able to isolate those that need to isolate and stop and curb the further spread of the disease. If you think about it, there are two factors to bringing back the economy. The first one is consumer confidence. But even before we talk about that, what about the employee confidence? There are many industries that cannot just work from home. Construction industry, the plants and the factories. And also our critical people, right? Not everybody in the offices are able to just work from home. Not everybody has that system set up or has that luxury in place. So we need to be able to undertake the steps to be able to provide or give back confidence for employees. So if we provide this system of regular testing, and the private sector, or at least the members of the private sector that are part of Project ARC, has committed to do this on a regular basis, and we will provide you the medical protocols and also the system on how you can implement this for your own needs, and customize it also depending on what your requirements are for your office. So if we are regularly testing, then at least within those periods of testing, we're able to identify and catch. Now, that doesn't mean na hindi na po natin i-implement yung social distancing measures, yung strict hygiene protocols, kasama po yan. And I think that's the first step. And, I always have this illustration when I talk about testing. No? You have two restaurants, one on the left, one on the right, restaurant A and B. So restaurant A, may malaki pong sign na nakikita kayo na this establishment does antibody rapid tests, they do regular disinfection, they follow safety protocols, they've been briefed on the medical side of it, then they know how to manage their workforce. No? Versus a restaurant on the right that doesn't do any of those things. Now, it's obvious which restaurant we will patronize, diba? Kasi syempre, mas komportable tayo dun sa restaurant that's been taking the necessary steps to keep their not only their employees but their products and services safe for customers. And that is for us a way to bring back consumer confidence. If we're able to create that seal, no, and able to commit also to the public that that seal has integrity in terms of the way they conduct their testing and the regularity of this testing. This is something that we aim. Now, there's no membership fee, there's no cost. All of the people that are working in ARK and all of the members in ARK are all volunteers, and we don't ask for any monetary we don't ask for any monetary compensation. But what we do ask for are two things. One, we're allowed to present to you the medical protocols that our medical team led by Dr. Mingita and the team of infectious disease experts and medical doctors to follow those protocols so that you may be guided. We will be talking to you. There will be a medical briefing so that we can talk to your doctor in the office or doctor that you engage to be able to conduct this, because it has to be administered by a physician. It has to be monitored by a doctor. And then we also have the data side. Apart from following our protocols, we have the data side. And this data side is very important because this data side allows us to consolidate the data, not just coming from you, but coming from the barangays that we do. Ma'am Ginggay is the head of our barangay team, and she's the one that conducts the barangay testings with the LGUs. And then consolidate that with all the corporations. So basically, sa barangay, you get them at their residence, and when they go to work, tinetest din po sa kanilang opisina. So we have that two-step approach. And when we consolidate that with a company called Thinking Machines that handles the data warehousing of the DOH. And doon po sa consolidation na yun, kasama po yung information from other sources. What are those other sources? Public hospitals, private hospitals, other LGUs, the OFWs, the airports, the IATF. And then once that's consolidated, it creates po this map. Our idea talaga is to be able to map every single barangay. Initially, we started with NCR, all 1,710, the residents and the LGUs, and as well as the companies that are working there or that are situated in that region. But we've expanded already to Region 4A, Calabarzon, and expanding still to other areas. In fact, our RT-PCR donations and hospitals that we partnered with has gone all the way down to Zamboanga. So talagang this is a nationwide effort for us to be able to make testing accessible to everyone. So what does it mean? Once we consolidate that and we map it, during ECQ or modified ECQ, lahat po yan pula. Right? Lahat po, imagine po itong mapa na to buong Metro Manila, lahat po yan pula. The problem is what we want to do is be able to really get what is happening on the ground. And we believe it's not all red. There are some areas that have very, very high community spread, and there are some areas that have low or even no community spread. And more than just lifting the lockdown or easing the quarantine on areas that have very low community spread, if we identify them through the data that you provide, we also want to be able to focus on those high risk areas. This is just a very simplified illustration. It can be 3 gradients or it can be as many as 10 gradients depending on the national and the local government. But at least kung meron po tayong high risk areas, the government can now reallocate and redistribute the limited resources that we have. And what are these? These are checkpoints and police enforcers, money, funding, food, if they're going to be if there will be a total lockdown, and a lot of other things like aggressive testing and aggressive treatment for the isolation centers. So ang dami po natin pwedeng gawin if we have all of this information, which is why it's very important that really ARK has been advocating are two things: follow the medical protocols, has been vetted and created by the medical team, and also is conforms to DOH guidelines and has been seen by many of the various medical associations like the PMA and whatnot, the Philippine Medical Association and whatnot, PASE, and then also provide the data. We will provide you the tools. We have a electronic data capture system that we will explain to you as part of the information kit. But you can also do this manually, and you can do bulk upload via Excel and CSV. So we have all the videos and all the information on both the medical side as well as the data capture side. So hopefully po, we can all work together in this fight against COVID po. Kailangan na kailangan po natin yung private sector. The government cannot do it alone. And I think right now, itong bayanihan na nangyayari po sa ating lugar, no, sa Pilipinas, sa Metro Manila, is really a step in the right direction and something that we're very proud of. And I think the government and the private sector has really put in a lot of the work to, to be able to fight against COVID. And hopefully you guys get onboarded very soon. Thank you po.
George, thank you. And since you were already on the topic of the barangays, and considering also that you were our first donor for the very first pilot that we did in Manila, baka pwedeng ikaw na mag-discuss nitong
Sure.
susunod na slides natin.
Sige ma'am. Apa, will do ma'am Gingay. Ito po, very simple lang yung framework, no. Again, this is purely voluntary. We don't, lahat po to volunteer companies at their own discretion, no. First, you can buy the kits anywhere. We have literature of the kits that we have validated on our own, but you can buy kits as long as they're FDA approved. You can conduct it on your own. But we also have a list of suppliers you can just get from the Project ARK team. Magaling po si Ma'am Jopin mag-negotiate. So all the way hanggang China po yung na-negotiate natin. Kaya nabaksak po natin yung presyo by more than 50% when we started and up to today. So usually our companies provide an allocation for themselves and then up to them po on how do they design the testing. But important also, and again it's very voluntary, that some of them also adopt a barangay, and usually they adopt a barangay that's around their office, no, because more often than not, their employees live around that area. So yun po yung idea behind that. And then that we allocate to these different LGUs. We facilitate and we talk with the LGUs, make these kinds of presentations to them as well, and work with their health units and their epidemiology and monitoring departments. And then from there po, we be able to create that system, no? Na nakita niyo po dito na talagang sa barangay side magte-test, mag-identify, mag-isolate at magte-test po for RT-PCR. Tapos ganun din po sa office area. So hopefully itong combination po, at tandem po ng two-step approach na to will give us more visibility in terms of the community spread, no. Now on top of this, we've actually expanded our scope to also do what we call seroprevalence surveys. We are doing this right now with Calabarzon and also NCR, with all of the mayors po and the governors in that region. And this is an official initiative of the IATF and T3. Yung T3 po, ito po yung consortium ng private and public partnership under Secretary Vince Dizon and Secretary Galvez po. So we're doing this survey so that we can do a baseline data kung ano po yung extent ng prevalence, no, ng infection po sa Metro Manila. And then after that, we will do succeeding tests, no, repeated tests over and over again over a period of 2 months in between, para makita po natin pag nagbukas po tayo ng ekonomiya or ito po ginawa natin polisiya, ano pong nangyari? Tumaas po ba yung infection rate? Bumaba po ba yung infection rate? Wala po bang change? So we can also make the necessary predictions. So lahat po to is really a data exercise. We want to get as much data as possible on our end, but on your end is an exercise of visibility, so you know and who are those that are infected and can protect your employees. So moving forward po, si Ma'am Gingay, Ma'am, I think the next slides will be already the medical stuff, no?
Meron pa, yung barangay testing results natin, George. And
Apo, sorry ma'am. Yes, tama.
Okay, thank you. Sige, ikaw na
Apo.
yan.
Sige po. Um, so itong barangay testing, basically we have several LGUs already. No, si Ma'am Gingay and her team has really been working very closely with the epidemiology departments and the city health officers. There's about 8 that we've conducted already testing. Ongoing po to, tuloy-tuloy. The idea is we kick it off with the pilot, and a lot of these LGUs have really just run away with it. No, in fact, see Manila, the first one that we tested, has just went full blast in terms of their mass testing or mass screening initiatives, and other companies are also following suit. No, so now we have 8. And we're still continuing to expand. Busy-busy po yan si Mang Gingay na talagang kausapin yung mayor pati yung mga health officers. So these are just some of the information that we have in terms of the testing. Next slide. Ito po yung magiging resulta basically. Also maganda na rin po tingnan nyo to so that you can see. No? Later po dun sa medical protocols, makikita natin po yung differences between the IgM and the IgG. Now just quickly po, no, yung IgG, ibig sabihin po nito, meron kayong nakakuha na virus, nag-recover po kayo from the virus at meron po kayong some level of immunity from the virus. Now, hindi po natin alam kung gaano katagal po itong immunity na to at to what extent. Iba po for different viruses. So may mga viruses po na lifetime immunity, katulad po pag nakakuha na kayo ng chickenpox, no ba? Nagpo-form na po yung IgG natin and you're protected for life. But for example, other coronavirus such as SARS or MERS, they have the immunity that lasts for roughly around 3 years. So ito po ang problema dito, hindi po natin alam kung gaano katagal po, but there will be some level of immunity. IgM po is for acute infection naman po. Ito po yung dalawang antibodies na napaka-importante, and part of our protocols will show you that separated po yung indicators nito. So makikita po natin a combination of IgM positive, IgM negative, IgG positive, IgG negative, and whatever other combination thereafter, no, between symptomatic and asymptomatic patients. No? So I think in reference to companies, siguro naman po lahat po na talagang symptomatic na, no, we will ask them to stay at home kasi wag na po sila punta sa opisina. But kung meron pong talagang mild symptomatic o hindi po nila alam na may sintomas sila, dito po ma-capture din po natin pag nag-testing tayo. So this is just an idea. No, we've conducted about 30,000 tests already to date. And you know, as you've seen, we've been able to identify and isolate, no, more than 1,000 individuals already, more than 1,000 individuals already, no, to queue for RT-PCR testing. So we have yet the results for RT-PCR is trickling in, and then we will find out later on kung talaga bang meron po talaga silang COVID. Pero at least na-isolate na po sila at hindi na po sila nakakahawa sa general population. Next. So these are just some pictures po, no? Some inspiration po that you guys can have in terms of how to conduct the testing. Hindi naman po complicated yung pagte-test, no? Most of this is semi-open air, no? Hindi po tayo nag-aircon sa loob sana para at least hindi nagsi-circulate yung hangin just within that confines. A lot of the different barangays use multipurpose halls, some use schools to be able to conduct it. Some use basketball courts. And then simple naman po, meron po tayong mga gumagamit po talaga ng acrylic na nakasadya for that, pero yung iba rin po is they really find a way to be creative to put in the plastic barriers, no, to separate the testers and then the employees as well, or the test respondents. No. Next slide. Yan po. So just a little bit more pictures, no? We will have naman an information packet to send to you guys so that you can review it amongst yourselves, and then you can just draw inspiration from this. Next. So, Ma'am Lingay, would you like to take this on?
Yes, okay. Thank you very much, George,
Thank you.
for all of that and for helping us with the presentation today and the discussion points. So moving on, okay, so Dr. Mingito wasn't able to join us today, no, but Dr. Padilla is actually the lead of our medical panel. And as earlier mentioned by George, no, we have several eminent physicians, no, on our medical panel. So this includes Dr. Solante, who's a an infectious disease specialist. He's also head of San Lazaro Hospital. And then Drs. Cabral and Dr. Dairit are both former health secretaries. And Dr. June Belisario is actually the dean of the UP College of Public Health and a public health specialist. So very eminent po yung medical panel namin. And they've actually also been actively consulting as well with other specialists from the medical community. And they have been really instrumental in putting together the medical protocols which need to be applied when you do your rapid antibody testing, as well as on the utilization of this in conjunction with the RT-PCR. So we'll just quickly breeze through these slides. Usually it's Dr. Padilla that handles this. We may have, I think we have doctors as well in the meeting. In case there's any question that George and I won't be able to answer because it's too technical, or in terms of the medical applications, we'd be happy to, take note of the question, and then we will be sure to have Dr. Padilla get back to you. Okay, so next slide, please. Okay, so part of the medical protocols that were created by Project ARK, no, and which we are giving to member companies as well as to LGU partners for the implementation of the testing. Part of these protocols include the methodology by which we can determine sino-sino ba yung kailangan nating i-test, who are the people who need to be in our testing list. No? So we have two layers actually for sampling lists. No, the first one is more on the targeted sampling, so we really identify persons belonging to these 4 categories. And then later on, we'll also show you that if you do have enough supply of test kits and you are partnered, let's say, with an LGU, you can actually also do random sampling. So some of the, you can also apply this to your companies. I know that many of you who have return to work strategies are already thinking about sino ba yung kailangan kong i-test, no, among my employees. So for the targeted mass screening in the barangay, where we do the first layer, which is really the targeted sampling, these are the 4 categories, no, to be considered for the list. So of course you have the probable and suspected cases. So these could either be symptomatic or asymptomatic persons, as long as they've had close contact with confirmed COVID patients, or they also could have had close contact with patients who are probable COVID-1 infected and awaiting results. Second category would be, of course, your symptomatic and asymptomatic frontliners. So usually sa mga barangay, with our LGU partners, they identify unang-una yung mga healthcare workers and people who are also in the business of serving the community. So ito yung mga barangay officials, barangay tanods, yung kanilang mga police, if there are military forces as well present to help enforce mga social distancing. So lahat po yan is sinasama nila dun sa kanilang sampling list, no, as part of frontliners. And then of course, you would also include, employees, persons in jobs like being security guards, delivery guys, factory workers. And as we know, as companies slowly open up, or institutions continue to operate, many of them are actually elected to test their own employees, lalong na yung mga skeletal force or yung mga frontliners nga na kailangan talaga mag-resume ng mga trabaho nila. So the third category will be those who are symptomatic for obvious reasons, whether kahit na sila ay mildly symptomatic and whether or not they've had known contact with confirmed COVID patients. So sinasama na rin po sila dun sa sampling list. And then the fourth category are identifying naman persons na considered high risk, even if they are asymptomatic. So ito po yung mga senior citizens and also those, regardless of age, who have comorbidities like diabetes, hypertension, yung pong mga may cancer or gross obesity. So all of these are being considered, these 4 categories of persons are being considered as part of the sampling list, which LGUs use to test general population in their selected or target barangays. So the second layer, next slide please. The second layer of testing, which was also advised to us, by Kantar, we can also do a targeted, a random sampling list, where from identifying the household of patient 0 or the patient who is a confirmed COVID-19 person, then you move the sampling size within a 1 kilometer radius from that home address. Now, depending on the density of the population of the area, this 1 kilometer radius can either increase or decrease. Like, for example, in the case of the city of Manila, when we were discussing this with them, and they also wanted to do some form of random sampling. But if you move within a 1 kilometer radius from the household of patient zero, that's equivalent to about 70,000 people, because some areas in Manila are so densely packed. So in that case, then they did a different method where they did the random sampling, but using left and right, no, meaning the streets, on the streets of the COVID-19 patient, gumamit sila ng left and right method, no. So there's strictly no set method for this, no. Usually what we would encourage companies is, if you're also working with statisticians, then you would also be free to consult with them. But so far, this is the methodology that we offer as a random sampling methodology for ARK members. Okay, next slide. Okay, this is a highly technical slide actually, but in essence, and this is something actually that, I was on the phone earlier today, with one of the owners of the conglomerates, explaining why it's possible that when you have employees coming out of antibody testing and they test positive for IgM, yung na-indicate kanina ni George, no, as being having an acute infection or an active infection. And then when they sent them for PCR and received the test results in like a day or a day or 2 or 3 days after, negative yung lumabas dun sa PCR. I explained to them that the way this virus is developing and the way that testing technology also is adapting to being able to detect. Whereas before, PCR can be effective to test, or they thought that PCR can be effective to test the virus regardless of, or within a longer period of time from the date that the person is first infected or first exhibits symptoms. It's not like that anymore, because the way that they've seen the virus behave is that within a short period of time, usually within the first 7 days, the virus moves from the nose to the throat and then bumababa na yan. Okay, so the timing of the PCR test is also critical if you want to have or you are expecting to find a PCR positive result. No? So the probability of getting a positive PCR result, even from your IgM positive, let's say employees or patients, goes down as the length of time extends, no? If that makes sense. So so we are constantly updating the virus detection chart just to help guide companies, and so that they don't get alarmed na, oh, we have like 10 employees na IgM positive, we sent them for PCR, pero ano naman, negative naman lahat yung result, no? So it doesn't necessarily mean na false positive agad yan. It's possible that because of the length of time from the day that they were exposed up to the time na na-conduct si PCR test, if they were tested after the 7th day, bumababa na talaga yung probability that you'll find a positive PCR result. Okay? And then at a certain day, from the day naman na mag-onset naman yung infection in the person, no, up to around more or less mga 7 to 14 days, tumataas pa yung probability when you use the antibody testing to find your IgM positives, okay? And then after the 14th day, bababa na naman ulit yan kasi syempre the person, lalo na yung mga asymptomatics, so sa totally no symptoms at all, nagre-recover, they're able to, their body is strong enough to recover, so nagre-recover sila. So bumababa naman yung IgM and then tumataas naman yung IgG. So again, it depends on when you use the test and how you use the test to be able to gauge the reliability as well of the result. This is also why the algorithms or the guidelines in interpreting results and managing results has also changed from the last couple of weeks to what it is today, even in the DOH guidelines, no, where before, if you have an IgM positive, dati ang protocol dyan, automatic papa-PCR mo na si person. But because of the way the virus is behaving, and because we found out that after 7 days, the likelihood that you'll find PCR positive result, bumababa na talaga yan. So there is now a new protocol in place, which we will explain later, na when you have an IgM positive person, what now do you do? Okay, what now do you do? If you have any other questions regarding this particular chart, which is actually very useful, especially for doctors who are in this meeting, as well as doctors who are being consulted by companies, no, we can actually have Dr. Padilla naman do a, like a separate medical briefing to explain this better. So can we just show the next slide, Claire, so I can link it to, okay, sige, Claire. Yeah. Okay, so yeah, we'll skip all these detailed. Can we go to the summary? We'll go to the summary. Okay. So, all right. So what I was mentioning earlier, okay, so if you look at this blue chart, right? So you have a positive or negative marker on either IgG, IgM, and then what is the decision and then the action to be taken, no? Or how do you interpret yung results? So if you have let's say a negative on the third row, no, a negative IgG and a positive IgM. Dati yung automatic ano dito will be, of course, you isolate the person 14 days, no, and then PCR test agad. Now the application or the protocol here is you can isolate for 14 days. So earlier I was talking to the owner of the conglomerate na sinasabi ko sa kanya, sir, pag ganon, you immediately send the person home. If you don't have a separate isolation facility, the person can quarantine sa bahay, okay? And then yung mga members din ng kanyang household, ideally, ipapatest din yan, no? But the person has to be isolated for 14 days. You don't need to necessarily RT-PCR test the employee. You can do with it, if you really want to, then pwede. You can also do without it, okay? The recommendation really in the protocols now is to do the antibody test again after 14 days, okay? After 14 days. And if lalabas yan, and the likelihood nga na lalabas na IgG positive na siya and IgM negative because a certain length of time has already passed, and most likely, lalo na in the case of asymptomatics where they are able to recover, then the employee or your employee can be cleared for work and can go back to work already. Ngayon, kung lumalabas pa rin na IgM positive and then IgG negative pa rin siya, you can repeat it again after 7 days. And if persistent pa rin si IgM, pwede kasing baka false positive na yan, and then we would recommend na you have to really confer with an infectious disease specialist, no? And of course, if your employee naman is symptomatic, regardless kung ano, talagang isolate and swab yan for RT-PCR. Because the likelihood na nandyan pa yung, ibig sabihin na may nag-fever pa siya and nandyan pa yan sa throat, sa baka makatch pa siya, okay? And then if, let's say, no access yung company to PCR testing at all, if let's say you have a business facility that's, somewhere quite remote, no, you would treat na lang the person as an IgM positive, and then you do, again, what are the action steps, no, dito sa row number 3. Now, if you have persons coming out of the testing who are IgG positive or both IgG and IgM positive, these are both considered recovered and may return to work, no? So we've tried to be up to date also in terms of the management and interpretation of results, and aligning it as well to what the DOH guidelines are also saying, and being as careful as possible, no? And earlier there was a question also by someone about how reliable, etc. I said reliability is dependent on a lot of factors, no, when you use these kits. It's how you use it, what brand of kits are you using, as well as the timing of doing the test, as well as what protocols are you following. Okay, so it's dependent on all of that. But for purposes of Project ARK and our member companies and the LGU partners that we work with, these is how we do now the interpretation and management of results. Okay, so next slide. Okay, so also in terms of the information we share, no, so FDA, as we all know, have approved a list, no, of antibody test kits, different brands, several brands, no. We're helping the government as well by validating some of these brands, no. So we're working with several eminent doctors, no. Most of them are infectious disease specialists, and also with different hospitals in NCR. And what we've been doing actually since March, since April, is really sending out samples and samples of all these test kits, so that they can come back to us with some kind of validation and let us know which brands are better than others. I mean, just like anything, there are good brands, there are bad brands. No, there are brands that are good for our purposes here, so that we can screen, we can isolate, and we can trace. And there are brands really that may not be useful to our objectives. Okay, so we openly share this information, and it will be part of the info packet that Claire and Sam will be sending you after this meeting. So it's an updated list of all the FDA approved brands that we have been validating. We'll also indicate there the suppliers, no, and all the contact information, so that PMA and your members, you are free to contact the suppliers directly. Okay, next slide, please. Okay, so this is the RT-PCR initiative that we had also mentioned earlier, and George also referred to this. So we're just showing you that we've really been a partner of government in helping increase RT-PCR testing capacity. When we get all the automated RT-PCR machines installed, and we've already started on a number of hospitals, but when we get all those commitments online, at least until the end of June, we would have increased capacity for RT-PCR testing to 24,000 a day. So that's quite a lot. And we will continue to do so. And many private sector companies have been very supportive and very helpful, and have been donating a lot of money, so that we can purchase they purchase the RT-PCR automated machines, and these are given to DOH accredited hospitals and laboratories. So next slide. Okay, so these are some of the hospitals, the first 12 hospitals that have been identified, and the implementations are actually ongoing. And then kasama ng pag-implement, the suppliers actually sent over also the engineers, to train the med techs, how to use the new machines. So I think the next couple of slides will be pictures, Sam. Okay, so pictures. Sige, go on. Of the machines are arriving in the Philippines, and then of course being received by the different hospitals, the beneficiary hospitals. So we have more photos, I think, in the next slide. Okay, yeah, okay. So next slide, please. Okay, so this is the supplier list, that I was the brand list I was mentioning earlier, and this will be part as well of the info packet that will be sent to you. Okay, next slide, please. So I think, yeah, okay, so brand suppliers. Okay, so we will also be sending this as part of your info packet. And then just to show PMA members, so this is an example of testing that's being done on site, in company facilities. These are actually photos lent to us by Soler, where they started doing testing of their employees as early as, I think, April. They were already testing. So they do have a triage setup for employees. So starting with the registration, then employees also, they fill up their employee information sheets. And then next slide, where it shows that they have, the testing area, and then the actual rapid antibody test being applied to one of the employees, so using the finger prick method. And then they also have a waiting area where employees can safely wait for results. And then when results come out, they do have a health teaching. So meron silang, yung physicians nila on site do explain the result to the employee, para lalo na kung halimbawa naging IgM positive sila, ano bang ibig sabihin nito, and then kung ano po yung gagawin. Okay. So I think, all right, next slide. Okay, yeah. So I think, Lucien, yeah, this is the end of the presentation deck. Maybe we can, do you want to tackle first the questions that were sent in advance? We can
Okay.
read the questions, and then, George and I can answer. Lucien, that's okay. We can
Yes.
now segue to Q&A. Okay. So okay, we'll tackle the questions on, okay, there's one general question about, will mass testing program be government funded, or will it be implemented at the discretion of the employer, and who will pay and bear for the cost of mass testing? So I believe this information has been made readily available in the public. You know, there have been several memos from the DOH, from the DTI, and also from DOLE, especially as companies were returning to work. No? So essentially, employers may test their employees. It's not mandatory. The cost of the antibody, if you're doing antibody testing, it will be covered by the employer. Yeah, so it's not being funded by government, no? Although for RT-PCR, there is a provision for PhilHealth coverage. But for antibody testing, this is going to be borne by the employer. Tama, no, George? Correct?
Yes, yes, ma'am.
Yeah. Okay, and then there's a question here, George. This is really for you. How will the data be presented on mass testing PH, and how can we ensure confidentiality in case of positive results? I read in the privacy policy that the page is used to inform visitors regarding our policies with the collection, use, and disclosure of personal information if anyone decided to use our service.
Apo. So basically, first of all, the test results for anonymized, no? And meron po tayong parang handoff protocol, if necessary, to the authorities, no, to DOH primarily, and also the hospital. This is the same way that the hospitals will divulge information to when needed if maging COVID positive po. That is after already the RT-PCR. The data that you input po here, first, dun po, we'll discuss this in the web briefing if needed, will be anonymized for analysis purposes. But when you're inputting the data, you can actually opt to not put the name. You know, you can put a unique identifier on the name, like an employee ID. And then you can also use your mobile number of the HR director or the company if you so wish. As long as they are identifiable from your end, no? So meaning all of the other information like comorbidity, birthday, has to be true, and then you can identify it if necessary. So for example, the person that you put in there and unique identifier employee number 00123, and then after that is the mobile number of the HR department, and then you send all of that information. If that person then later on turns out to be COVID-19 positive, then we will either get that information, the DOH will get information from the hospital from where the test was conducted, or if it goes through ARK at all, then we will refer them to your HR director, and then your HR director can now identify that person and divulge that person directly to the authorities po, for purposes of contact tracing, and treatment and isolation. So yun po yun. So those are the steps that we can take to make sure that all data is anonymized. We don't require, and in fact, we highly recommend that you don't put the name. You just put the ID number or employee number. And then also just refer to the mobile number of your HR representative or your company representative. That's what we recommend po when you're filling up the data. And then the rest, make sure lang please, because important po dyan, as you will see later on, is the residence. Because nakalagay po sa residence dyan, is broken down into what we call PSGC. Ito po yung format na ginagamit po ng lahat ng government agencies. So this is region, city, district, and then barangay. So that we are able to map po ng maayos, 'di ba? So kahit kunwari po company ABC tayo, BGC branch, and meron po tayong 40 na employees doon, sana po yung ilagay po natin is hindi po yung BGC branch but rather yung place of residence po ng employees. Hindi naman po detalyado yon, it's only detailed up to the barangay level. So again, it's still protected, it's still anonymized, and we are unable to reach your employees directly po without your help or without the company facilitating.
All right. Okay, George, there's another question for you. The question is, will we be required to upload our test results in masstesting.ph, or is this voluntary?
So yung masstesting.ph po, there are two ways po that you can upload the data. First is individually, and it's an individual registration. You get a patient ID, and then we give you an account, and then your testers is able to add the test individually. The second way is to do it via Excel sheet and CSV format and bulk upload it. But I think the question here is not the ways to upload it, but the question is really whether it's voluntary or mandatory. Again, when I discussed dun sa Project ARK requirements to be a member of the Project ARK companies, we will need your data. And we hope that you can share that data with us because we are sharing freely also the medical protocols. But again, we do not want specific data to reach your employees that can be anonymized. We just want the data of your test results so that we can consolidate it. When you give us your data, you're contributing to the consolidation of information that will help our government move forward and create policies that will be able to fight COVID-19. So this is something that's going to be very important. And, hopefully po you find value in be participating in this exercise.
All right. Another question, George, on data
Yes, ma'am.
capture system. They're asking, do you have digital certificates?
So all of our data, wala po tayong data certificates that you will um that you will get you will need to get, no, but all of this data is encrypted. We have privacy notes that we can send to you guys upon request so that you can see the full breadth of what are we using for encryption. um, if that is the technical question in reference to the data, no, but in reference to an actual certificate, a project R certificate, I think yes, we will be providing those types of certificate to ensure that you are a full-fledged member of Project ARC and have been conducting all of these testing, regular testing that conforms to the medical protocols that was provided. I hope that answers the question because I'm not sure if it's the certificate of Project ARC or an actual technical data certificate of the data capture.
Okay, all right. Thank you,
Yeah.
George. Okay, so we have another question here, but more to do with procurement. So what is the minimum order quantity? I suppose that will depend on which supplier you are going to be negotiating with. In the list of test kit brands together with the supplier information, all the information coming from the supplier in terms of what volume is available, what's the minimum quantity, what are the payment terms, etc., it's all there. So please feel free to use the information and contact the suppliers directly. And then another question here is, can we donate the kits if we decide not to use them? Yes, of course, you can. If you are planning to donate na to a barangay or an LGU, where you do have your business operations, please also let us know. If let's say the barangay or the LGU has not started antibody testing, then Project ARC would be very much happy to assist and support so that they can be briefed properly on how to implement it. And we have been doing this actually in partnership with many of the Project ARC member companies, helping them and their LGU partners how to implement antibody testing in the general population of the barangays. And then another question, who can avail of mass testing? So, I mean, ideally, it should be available to all. No, what we are discussing here is really testing of employees, to be sponsored by their employers, so getting the commitment of companies to test their employees regularly. And then also, of course, in partnership with the LGUs, is testing the general population, and as we explained from the very beginning, the advocacy of ARC is really to make testing available to all and make it affordable. Another question is, our company will have to establish our own medical team to carry out the testing. As per the documentation, the team should have at least one physician and one nurse or med tech to perform the test. Can we choose these individuals? Yes, of course. Some of you may already have medical teams within your organizations, or you may have third-party medical service providers that you work with. So yes, definitely you can choose your own medical team. The minimum requirement really is that there should be a physician on site, during the testing implementation. It's very important because even our medical panel doctors say that testing is really a guide or one tool, but you still need to make a clinical diagnosis, especially in a case where the patient or the employee is complaining of some kind of a symptom. No? So kailangan talaga may clinical diagnosis si doctor. No? And the entire testing implementation has to be overseen by a physician. So, but yes, no, you can have your own medical teams. If your medical teams are not well versed on how to use antibody testing, then we are also more than happy to put them in a webinar, and we do this actually quite regularly. No, so Dr. Padilla conducts medical briefings. We include medical teams from companies. We also include medical teams, city health, barangay health, municipal health officers. And then George also conducts regular webinars naman on the data capture, the data consolidation, and how to move your data from your company database to Project ARK, no? And then what does Project ARK do with that? So George also does webinars, and Claire and Sam will continue to share the information with PMA on when these webinars will be held. No? And then also on a monthly basis, our Project ARK leader Jopin will also be conducting like a regular update meeting for Project ARK members. So that's also open. People can come and sit in and listen to what are the latest developments in terms of the testing universe. So are there any other questions, Lucian, that we can answer? Just a time check, it's 4:20 right now, but we still have time to answer more questions kung meron pa, or clarifications to any of the information. Wag lang masyadong technical at medical kasi hindi kami doctors ni George.
Opo, hindi po kami doktor. Pasensya na po. Doktor-doktoran lang.
Okay, Lucian, you're on mute, ha? You might want to unmute yourself, and Ma'am
Oh,
Christine.
sorry.
Yeah.
Yeah. Regarding the test kits, is there a base rate that on the cost of per item?
Per kit.
Yeah.
Yeah. Okay, so what we've been using, actually what George alluded to earlier, the kits that we're using for many of the company testing as well as the testing in the barangays, was priced at 450 per kit. I believe that Joey's been working tirelessly to try to get the prices down. We have a couple of other brands that are being negotiated for, also very good brands. That hopefully some of the suppliers will be able to bring it at an even lower cost. So if it's just the kit itself, and ito paulit-ulit din na natatanong sa amin to, kung cost of kit alone, it's about 450 pesos right now. We're hoping to bring it down to maybe 400, 350, the good brands, ha. And then you have to add on to that cost, syempre yung cost of administering the test, especially if you're going to get a third-party medical service provider. So depending on who you're using, may additional cost ka per person. But kung just the kit itself, yeah, it's more or less ganun, 450. There are other brands that are a bit more expensive, no?
For baseline, guys, just so that you can tell other people na masyado kayong mahal, there are available medical service providers that are doing it at 500 pesos per person, but that will go all the way as high as without the kits, no? That can go all the way as high as 1.5 with kits, right? So ibig sabihin kung 500 siya, 1,000 niya pinipresyo yung kit niya. So at least you'll have a basis for comparison and you can kind of haggle there. Now, your kits sa labas, siguro hanggang 600 pesos, okay. Anything beyond that, you can tell them, hey, si ARK is giving it at 450. There's some at 520 of different brands, no? But then mga 600 siguro, that's not so bad. But then others are selling at 800, even at 1,000 pesos. I think that's too expensive for the kits. Yeah.
Correct.
Thank you.
Those are baseline prices, so at least you'll have a way to negotiate.
Okay. Alright. Ma'am Christine, baka may questions din po kayo.
I'm good. It's really more on the price. So at 450.
Alright.
Ako, last question.
Yes,
In terms of the efficiency of the test kits, what percentage would you gauge
okay, usually that's a
on the
question.
efficiency?
Okay, yeah, usually that's a question actually that's handled by Dr. Mingita, no? But based on the validation studies that we've seen, and based on, okay, I'm not sure if we have the slide here, no, but there was a study conducted by Makati Medical Center, and they did a test on several different they did a test on several different brands, no, and it's also the basis why we decided to go, let's say, for a test brand like Innovita, which is, I think, George, correct me na lang if I'm wrong, parang nasa 70 or 75%. Tama ba?
For ano po, for sensitivity po.
Yeah.
For specificity po, 90 plus.
90 plus. Okay.
Yeah, apo. So the difference po ng specificity pati sensitivity, yung sensitivity po will be attributed to false negative, and then yung specificity po will be attributed to false positive. So dapat po mataas po yung importante po talaga mataas yung specificity natin.
Yes.
Mhm.
Does that answer your question, Lucian? And there's also, reliability. It's also how you use the kits, no? I mean, if your team is not well trained and they don't know how to use it, or you're not able to draw, you're using finger prick method and hindi tama yung pagka-prick, hindi masyadong malalim, etc. This can affect the result, and things like that, no? Also the
Pero
time.
most of the rapid test kits are, is it through finger prick or swab?
Sorry, finger prick or
Swab. Through
I
swab.
think, yeah, the swab is for the PCR. For rapid antibody testing, it's finger prick or the venous blood draw. So you have to use a needle. Yeah, but you can do either. Some companies do venous blood draw. The other companies naman, they do finger prick. In the LGU testing, they do finger prick. So in the Makati Med study, George, diba, they did both, right? On the same.
Both po,
right?
yes.
Yeah.
Pero which one is more efficient? Yung finger prick?
Actually, based on that study, in Makati Med, and right now, actually, all the MPIC hospitals are using, let's say, like Innovita, no? And there are also other good brands like Gene Orient, and Ilgen. Either method works, no? You just need, if you're doing finger prick, kailangan may lalim, okay, and then so that you can draw out enough blood from that finger prick, so that there's enough blood that goes into the well of the cartridge and then mixed with the reagent, and then you get a clear sample. Pag masyadong mababaw yung pagka-prick and you put the blood there, masyadong konti, baka very faint. Baka pwedeng positive si person pero very, very faint yung line, no? Halos hindi mo na mabasa. So merong mga ganong cases din. So you really need, your med techs and your nurses will be implementing the testing need to be trained how to do it properly if they're doing either finger prick or even the venous blood.
Meron naman pong medical briefing, and then doon din po sa medical protocols in terms of administering it, no? At the end of the day, pareho po siyang dugo. It's just really the amount of blood. Usually it's the 20 microliters, the amount of blood that you put in the well that makes the difference po.
Yeah.
Okay.
George, there was another question here pala about did you provide a certificate after this? Sorry, what certificate do you mean? Is it
I guess certificate ng after the presentation that they attended the certificate. Wala po. So yeah, I think that's the
Loremi Lucero. Was this what
Yes.
you're referring to, no? Certificate after that. I think we are not doing that. But I guess, no, if you're in the photo op-ed, that should be documentation naman that you attended. And we are recording din naman this meeting. So, yeah. All right. Any other questions? So, we are...
Sorry, I just want to ask, like, if somebody is interested, how fast can you act on it? I mean, how soon can you implement, let's say, the testing? And do you have enough stocks? Kasi diba, what they're saying is there isn't enough testing kits. But with your group, I mean, do you have enough?
Ma'am, you're referring to testing for employees or test?
Yes, employees, sorry, because most of us members are from the corporate world.
Okay. So what you would need to do and what we would suggest, no, for organizations like PMA is you would probably need to go back to your members and try to find out who among your member companies would like to embark on antibody testing, and then we would encourage PMA to consolidate that volume or the number of orders of test kits, and then we freely give the information on all the suppliers, so you would be free to contact them. If you're not comfortable doing it, we also have a team that can assist you. We have a whole team that's dedicated really just to talking to suppliers. Jopin, this is one of the things also that Jopin is doing very actively. But we would encourage your organization to really help your member companies by consolidating or pulling together the orders. Also, so that when you do make the purchase, no, it's volume, so you would have a better pricing, leverage, no, with the supplier. Anything you
Okay.
want to add to that, George?
Just to clarify din po, ma'am, we don't do any testing ourselves, no? You will have to make sure that you have a medical team, or you partner with a medical service provider that can administer it for you. I think we have some that we can recommend. If I'm not if correct me lang if I'm wrong if there is, but then we don't do the testing ourselves.
Yes, yes. I just wanted to ask, how soon can they act on, let's say, if you want to undergo such?
Testing.
Oh, yes. Like,
Uh-uh.
let's say I closed a deal with them.
Mm-hmm.
I mean, can they do that 1 week after, 2 days after, next
Meaning
month?
with the service provider.
Yes, with the
Would
service
be
provider.
Okay. It depends, ma'am, on the service provider. You would really need to discuss this in detail with them. I
Mm.
think George, the group that you were mentioning earlier, no, sorry, are we allowed to say that, no, HCT? Tama ba?
Yes, I
One of
believe
the,
so. Yeah, sila
yeah,
yung pinakamura na.
yep,
Yeah.
yep. That we have found so far, no? Yes, so
Yep.
HCT. I think mabilis naman, no? But it really depends kasi we all, that's the challenge now of many companies, especially the small ones, no? Who's going to do the testing for them. So we really encourage yung consolidation, lalo na organization. You help your member companies. Some of you may also be having some negotiations ongoing with let's say providers like HMOs, no? So it should be pretty quick as long as they have the medical personnel to do it, and they know how to apply the testing protocols, and then they are set up as well for the
Mm-mm.
Mm.
administration, no? In terms of the data capture, you can just use the ARK system that George has set up.
Mm. Okay.
Yeah.
Most of the suppliers come from China.
Yes.
Okay. How many percent?
I think most of them. With Claire.
Ma'am,
Yeah, do
we
you wanna
have,
share do you wanna show lang the slide that has all the suppliers? I believe no, most of them are China. Although may local distributors naman dito, 'di ba? We've
Yes.
identified a few, no? May local distributors, meron sa Parañaque, meron.
Okay.
Should be easy enough for you guys to contact the suppliers directly.
Mm.
Okay, so last question is antibody rapid test kits. You can get the results in 10 to 15 minutes. Yes. And in fact, you should be reading. That's why the training is important. The medical training is important because Dr. Mingita will also stress about this, that you have to read the results within a certain amount of time. It's not like you do all the testing and then you read the results like hours after. So you really have to do it immediately after. Okay. So yeah, okay. So we're just quickly flashing this, but anyway, Lucian, all of these information will be sent to you, which you can then share with your member company. So it's an information kit that we give to all of them. So ayan, mostly China, except for CPK, which is US, but then we've also identified naman yung Philippine suppliers para madali, no, for you guys to contact them and negotiate.
Mm. Okay.
Yeah. Okay. So
Thank you.
yeah, if there are no other questions, we'd like to thank you, Lucian, and Ma'am Christine, and of course, everybody from the Philippine Marketing Association for your time today. We'd like to say thank you to George. who's always present when
po.
we're doing the briefings and explaining things, and especially doing the webinars on the data capture, which is very important.
Well, thank you, Jinggai and George, for taking us through about Project ARC. It's really enlightening, and it hits hard actually, that we really want our companies to be back to business, and the first step is really trying to gain the employee confidence. So thank
Yes.
you for this. We'll discuss this internally.
All right.
Thanks,
Okay.
thanks, guys.
Thank you,
Thank you,
everyone.
Ma'am
Thank
Gigay.
you.
Thank you,
Thank
Sir
you.
Lucian, Ma'am
Stay
Christine.
safe.
Sige po.
Thank you.
Thank you.